Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Sarah Anderson. This episode features a patient's perspective on living with HIV. During this podcast, Yvette Raphael discusses her experiences with the HIV care continuum and her thoughts on how healthcare professionals can advance efforts toward ending the HIV epidemic. For more information and for a link to the full online educational program, please visit the link in the show notes for this episode. Now, let's get started and hear what Yvette has to say about her experiences as a person living with HIV. Welcome and thank you for joining us today.
Thank you, Sarah, and thanks for inviting me to this very important discussion.
So I thought we would start with a few questions about your diagnosis. If you wouldn't mind sharing what prompted you or encouraged you to get tested for HIV.
Sarah, I got tested for HIV just in 2000, a year after I had my baby. And I think what made me test is I was just not feeling well. I was not feeling 100%. I felt I was losing a lot of weight. And I thought, why not start with the most scariest? I was not scared of cancer at the time. I was not scared of, being diagnosed with any other illness. I thought, let me start with HIV. And if it is HIV, I would know how to deal with it after that. So basically just my overall health, I didn't feel good. I still tell people I felt very heavy. I felt like my body was carrying so much. And also the weight loss was very worrying because every time I'd go to people, they would ask me, why are you losing so much weight? And the mirror of seeing yourself every day, you really don't pick that up. But I picked up a whole lot of questions around my weight and I decided to go and test.
Sure. And I'm glad that you got tested. And what was your initial reaction or your feeling to being informed of your diagnosis?
So I'm from South Africa, and South Africa stigmatized HIV a lot at that time because of obvious reasons. Our president at the time, the Minister of Health at the time, just the stigma around HIV was a lot. So my reaction was fear, and the fact that I had a 1-year-old baby was very scary for me. And what would happen to her? I did not want her to be an orphan. I did not want her to, raise herself. And I had first-hand experience in my country about how devastating HIV. So it was fear. And I still say, after the nurse told me in AIDS jargon or HIV jargon, medical jargon, that the result says reactive, I think it just went black. It was black for a minute.
What do you wish would have gone differently for you?
After my diagnosis, I only gave myself a little time, to pick myself up, get over the mess, and just deal with it. I think what I would have done differently is I would have put my patient on a couch, be in comfortable position to disclose. I remember I was standing on the 7th floor of a hospital building, and it was scary. I felt dizzy. I was turning out of. I would have just wanted the nurse to be more kinder, because I almost felt like she was blaming me. It says reactive. There's a doctor down the line that helps people. I don't know. Maybe you got a week, you got 2 months, 3 months. I think I would have wanted the nurse. I would have wanted a different kind of approach to how that news was broken to me. At the time, it sounded like a death sentence. So, and we know the stigma in 2000. So obviously, she knew even her own humanity needed to come out. So I would have done it differently. I would have been much kinder to my patient.
So after you received your diagnosis, what helped you get linked into care?
My diagnosis happened during the very denialist time in South Africa, and medications weren't available that easily in South Africa. I was lucky. I just started a job. Everything was going on well for me. Like I said, my baby was a year old. And I just had medical aid, what you guys call Medicare in the US. And I had medical aid, so I could access medication. But, when I look back and you talking about the care pathways and how I was received into that healthcare system was very different, because the story for somebody who's not working in South Africa is very different. So the nurse told me about the doctor down the hallway or few floors down who was helping people, giving them ARVs. She really doesn't know if it works. But yes, there's always a queue outside of his waiting rooms. And I went to see that doctor, and he is still my doctor today, my specialist, because he has grown. He's no longer just the backdoor HIV doctor who was prescribing ARVs that the government did not want to have. We really didn't have guidelines at the time I was receiving ARVs. But yes, that is how I got into healthcare. I did not have a clear pathway, just the nurse telling me about a doctor down the hallway who was prescribing ARVs.
Did you have any other friends or family members, or did you know anyone else on ARV at the time?
I was actually one of the very first few South Africans who started treatment because of how difficult it was. So I did not know anybody who was on ART. I actually became the guinea pig for and I don't like using that word, but for my friends, for my circles, that, you can live long. It's because of everything I got, all the steps in my life, because I'm an activist. I'm a human rights activist. I'm an HIV advocate and I'm HIV prevention advocate. Everything I had to do, I got was through fighting because of my activism, right? So my advice would be start as soon as possible. I had to start when my CD4 count was 200. And I fought for South Africans to get ARVs when, as soon as possible, not to wait. When 200, it's like your body has wasted already. Repairing your immune system, it was difficult at the time. You would get sick from the ARVs. You would get sick from just being sick. So start as soon as possible. There's no need for you to wait. Advocates like Yvette Raphael, Vuyiseka Dubula, and many others in South Africa fought for us to start treatment. Just get yourself mentally prepared to make a lifelong commitment. That's another thing. When people said lifelong commitment of taking ARVs, because of the stigma at the time, I thought, 5 years, okay, I can do that. It's been maybe 24 years today. So yes, it is that long.
What advice or suggestions would you have from the healthcare professional side of things to how to approach that?
To just approach it positively. So when I tested HIV positive, it looked like a very negative thing, right? How negative it's going to be. But I looked at it and I'm like, actually, it's positive. It doesn't say you're HIV negative. It says you're positive. So my outlook on life changed. So if we all can just change how we look at things and how we, how we use some of the motivation. I always say to people, the first contact of somebody who tests HIV positive, the very first person they meet is going to make or break their ability to live with HIV. So just be positive about everything, positive about taking your treatment. But I just think you live every day and you die once. Nothing. Every day should be a day that you are happy, that you do the best that you can. So for me, the advice would be just be positive about it. And your mindset can really change how you feel and look outside, on the outside as well.
What keeps you in treatment?
What keeps me in treatment is family. What keeps me in treatment is my kids, it's my husband. What keeps me in treatment is the fact that I know I want to live. And it's okay not to want to take the treatment for that day, but please make it just one day. Don't make it an everyday thing. It's okay to feel that it's too long. It's okay to feel sad, because sometimes I still take, because I've started treatment a long time ago, I still take almost like a handful of ARVs, not one pill, DTGs, or whatever people are taking now. But I just take it because I want to live. I want to see my kids. And throughout my HIV status, have I set milestone? I wanted to be at the World Cup when South Africa was hosting the World Cup. I wanted to be at my daughter's graduation. I want to be at my son's first baby, when he has his first baby. I always set milestones for myself and things that I want to see happen. And I know I don't have total control over all of that, but just knowing that I have something to look forward to. And I have a beautiful husband who's very, very supportive, who reminds us about my treatment. So on our calendar is our treatment, and my husband is HIV negative. He puts our treatment, our medication time, and that makes me just want to be as positive as I can be.
Is there anything that we haven't talked about that you want to share about your thoughts for ending the HIV epidemic, or your thoughts on living a happy, healthy life with HIV? Anything else that you'd like to share?
I have a few messages to researchers. We're looking forward to the cure. We're looking forward to a vaccine. For people who just been diagnosed with HIV, it's not the end of the world. You can basically live a healthy and happy life with this diagnosis. It's life-changing. It's just not life-limiting. So what you have to know is your life is going to change, but it doesn't mean it's a limit. Just live your life to the fullest and be somebody who helps others. I think one of the things that got me through is with my diagnosis, I decided just to be a good person because I was faced with death.
Thank you very much to Yvette, and thank you to our listeners for joining in. As a reminder, to view the full Accelerating the Pace Toward the End of the HIV Epidemic program on our Clinical Care Options website, please click on the link in the show notes for this episode. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.